topic of discussion is helleborus niger, that is Christmas rose ranunculaceae family. What are the other drugs of ranunculaceae family? Remember, that are our pulsatilla, aconite, and our Staphysagra. So four drugs regarding you should remember about ranunculaceae family. Okay, so ranunculaceae family, Staphysagra, pulsatilla, aconite, and helleborus. Now we discuss about the helleborus. Is particularly in clinical, you should remember the signs of a helleborus. What is the signs? That is particular we go for the that is the person who are or a child having acute hydrocephalus. Hydrocephalus is the line which is important for important line, that is mainly we discuss, that is hydrocephalus. So hydrocephalus means what? There will be brain symptom, that is hydrocephalus due to the fluid effusion which results in hydrocephalus, threatening effusion which causes brain trouble. So helleborus is mainly indicated in the case of brain trouble is the main important point. We shall discuss that helleborus is generally known for its action on a brain, that is brain trouble due to the effusion of the fluid, serous fluid effusion which results in brain trouble. That's why the person there will be the person what happened, there will be the person became hydrocephalus is the important point due to the hard pressure found in the brain. There will be the person always, when the person means the child, to release that tension which accumulated in the brain, boring the head into the pillow. Why he or she boring the head into the pillow? Because to release that tension which results due to the serous effusion causing brain trouble, that is hydrocephalus condition. Rolling side to side and beating head with hand. This point you should remember regarding helleborus. In clinical and viva, what is the important point I shall discuss. Now we go line by line. What is the important helleborus? Due to the brain trouble, the children became weak, delicate, sorry, like belladonna, calcarea, and tuberculum. You should remember this calcarea, belladonna, in the sense that they having brain trouble, there will be weak, delicate person will be occur of sorry. So here the main causation you should remember always, the any drug there should be effect if comes, then one cause is present. So in helleborus there will be main cause is serous effusion. Okay, now the patient is melancholic or full despairing due to the cause. There will be serous effusion. The effect is that acute brain trouble will be occur, acute hydrocephalus condition will be occur. That's why the person became so melancholic, despairing nature, and very much anguish. After typhoid there will be melancholic, gas in the puberty or menses if return to appear, then it occur. Irritable, easily angered, but you should remember consolation, aggravation. So what are the other drugs about consolation, aggravation? Ignatia, natrum, muricipia, silesia, and helleborus. These 5 drugs you should remember, because viva always asks what are the drugs about consolation, aggravation, ignatia, natrum, sepia, silesia, helleborus. Does not want to be disturbed. Okay, does not want to be disturbed, like gelsemium. Gelsemium do not enter any person inside the room because he becomes so irritated. That's why gelsemium. And unconscious, stupid, answer slowly when questioned, because of the acute idiocy, because of the brain trouble he become acute idiotic mind will be occur. That's why answer slowly, do not answer quickly. Okay, now the chronic is our variety curve. Now the sensation, there will be brain symptom appear in the child in which period? That is a dentition period, like belladonna and podophyllum. Okay, belladonna and podophyllum. Podo also there will be same thing appear, but comparison is that in podo there will be marked prostration is found, but in belladonna there will be violent congestion will be found, but in helleborus there will be serous effusion will be found. So different type of congestion is present in different term. Now the threatening effusion, like apis tuberculinum. In apis you should remember that there will be suppressed exanthema which causes due to the suppressed exanthema or suppressed eruption. That's why the brain trouble occur. But in the helleborus there will be serous effusion. Due to the serous effusion, there will be complaint arise. Okay, now the serous effusion means what? There will be effusion, exudate will be found. Exudate when come, there will be infection, there will be exudate. So here the exudate is causes meningitis. That type of a meningitis, that is a tubercular meningitis. That's why there is another mygium can be found, sora or a tubercular mygium. Okay, then paralysis is more or less complete with cryencephalic. What does mean cryencephalic? Cryencephalic means when there will be person who are encephalic. Encephalic means the hydrocephalus condition, there will be the children cry, and this cry is called as cryencephalic. Okay, now this important line, that the eyes become wide open and vacant and thoughtless. Like when in our day-to-day life, our eye means lot of things. Our eye is the expression of our face, but this helleborus child, there will be eye is staring, that is vacant, no thought. There will be just like a robotic eye, there will be no movement on the pupil, like a pupil is dilated and alternately contracted. So there is many drug about this point, that is you should remember that pinpoint pupil is opium. Pinpoint pupil in which drug? That is opium. Okay, pinpoint pupil is opium. Now calcarea, nitric acid, stramonium, these are pupils are contracted and dilated. You should remember this line, pupil which are contracted and dilated alternatively, these are the calcarea, nitric acid, our stramonium, calcarea, nitric acid, okay, stramonium, and helleborus, pupil contracted and relaxed, dilated continuously. Then the person who are child becomes during sleep, there will be convulsion, and the convulsion time they scream and they shriek start. Hydrocephalus condition, remember hydrocephalus condition with super sleep screaming. Okay, now the automatic motion of the arm and the leg. So this is a sign you can find in the patient. If you ask the child that during convulsion any type of motion the parents seen, then if the helleborus is peculiar thing is that the motion of a warm arm and a warm leg is found. Okay, then during convulsion there will be extreme coolness is found in the body except head and occiput, which may be hot, like arnica, like belladonna, only palm, face, soul will be sweat or cold, but in arnica there will be head hot, extremities cold. Now greedily swallow cold water, bad spoon during convulsion, remain unconscious. But aurum, here one comparison is found, aurum trifilium, there will be during convulsion the he or she is conscious, but here the person is unconscious and bites the spoon. Okay, now the chewing, the motion of the mouth. So here important line is that this line commonly acts that the mouth nostril become dirty and sooty. Okay, now due to the ulceration there will be corners becomes sore, and like tarantula, like stramonium, he pricks the clothes boring into nose. Okay, pricks the clothes boring nose into the with fingers. Okay, that condition is with unconscious time, but aurum trifilium there will be conscious is found, boring head into pillow, siding, beating, which I discussed before. This is the important line commonly asked in the PG. Then now viva commonly asked that diarrhea is a peculiar diarrhea, that is jelly like mucus, but important line is that frogs prawn like that is span like diarrhea, involuntary diarrhea, colorless, tenacious, but frog span is peculiar, which never find in any drug rather than helleborus. Urine, due to the acute serous effusion, there will be kidney problem will be occur, and that causes red, black, scanty urine due to the dropsy, due to the effusion. That's why the urine became red, black, scanty. Suppressed brain trouble, due to the suppression of the brain trouble or dropsy, the urine is found in this type. So dropsy will be found in the brain, abdomen, after scalatina, and here the fever is occurred due to the suppressed urine from suppressed example like apis. So apis and helleborus prae similar, but you should compare it by the thing that apis there will be serous effusion is not found, but there will be suppressed eruption which causes brain trouble, but here the all things are due to the serous effusion. This is all about helleborus. Thank you.